panel. Our panel tonight, we're talking the future of privacy and security in healthcare. And the way this is going to work is we have a few questions, and then we're going to ask a few different points during the panel discussion for audience questions. So if you have some, save them out in your head, think about your comments, think about your questions, and let's have a really spicy conversation.
Spicy conversation. I wonder what you mean by that. So I'm just going to actually ask each member of our panel to just quickly introduce themselves and tell us a little bit about what they do.
Hi, my name is Wang. First, I'd like to thank the HealthTO team for inviting me, and thanks for the crowd. I spent about 10 years at Sickness building products for the hospital, and I recently started my own company called ResearchDB, and we act sort of like an app store for scientists and researchers. I also recently started a fund to particularly invest in early stage startups to help them get to the first professional venture round. So I guess I can speak from the enterprise startup and as sort of like an investor perspective.
Cool. Hi everybody, my name is Dustin. I'm the CEO of Akira. Akira is a doctor in your pocket. Take out your phone, press a button, there's a doctor. Basically, we want to make sure that you don't have to ever sit in a walk-in clinic waiting room ever again. And I'm really looking forward to this discussion. I'm kind of wondering why I decided to speak on this topic in particular, but I think it'll be really cool. So.
Hi, I'm Aliya, Ramji. I am the Director of Legal and Business Strategy at Figure One. Figure One, as Aliya told you, is a healthcare platform for healthcare professionals to connect in real time, share cases, and learn and teach one another.
Thank you. I'm Soyao, and I just want to request, I am not the CEO and founder of Figure One, as it's here. I think you made a mistake. I am the CEO and founder of Self-Care Panelist. So, just want to correct that. So, what is self-care? So, anyway, very good. That's pretty quick. So, Self-Care Panelist mission is to actually empower patients. So, we want to enable patients. We want to shift the power of health to patients. And how we do that is we enable them to build their own health storylines. And all of us, as we go through our journey, we are going to build a lot of data points about our health. And we know that as we build data around health, it's going to inform us of how we're going to make decisions. So our view is that in the future, we probably will be the one who's going to tell the doctors that this is the kind of care and action that I want to take for my health, instead of the doctors telling us what to do. So that's our mission, and I'm happy to be here and talk about privacy and security, for which we have probably somehow a different point of view on that.
Perfect. Thanks, Grace, and sorry about that. We do know what company you're part of. We're just in the frenzy of getting ready for the event. That's corrected. Okay, so let's get started. So our first question is just tell us about how your company has dealt with patient privacy in the current digital landscape.
So at ResearchDB, we deal mostly with healthcare researchers, and so our very first sort of policy is don't deal with anything that has to do with identifiable information.
Nice.
Yeah, so it's one of those things where if you can avoid sort of any exposure to begin with, it helps. And I think part of it goes, a similar type of thing can be implemented on a clinical setting, which is if you don't have to deal with certain patient information, just don't deal with it. But of course, at some point, some of these researchers would be having to look at identifiable information just for their particular area of interest. And that's when we sort of start spending the big bucks to get compliant and everything, and it's not fun.
Yeah, so we deal with identifiable patient information every day. It's sort of the opposite case, I guess. And one of the reasons, actually, when we went into this particular industry, there's sort of a distinction, right? You're either a care organization, you provide care, or you are a software vendor. You sell software to clinics, to hospitals, whatever. And the distinction is that if you're a software vendor, you really can't do anything with the data. You can't use it for your own purposes to improve your product, to deliver better care, to use for machine learning, unless you anonymize it, you've got permission, you go through a particular set of processes. Whereas what was really important to us was to have engineers and clinicians and designers sitting side by side, working to build the future of healthcare. Necessarily, that means that we do have to handle identifiable patient information, but we also have to have really strict controls about who can access that information and what they can do with it. So for us, the only people who can look at patient data are clinicians and support staff for the clinicians. We have to make sure that our developers never actually touch identifiable information, which is an interesting challenge inside an organization, but at the same time, it also really helps us to see the kinds of problems that we're going to be instrumental in helping to solve in the future.
So we kind of sit in between the two, where we have patient images, but they are de-identified images. So there are 18 factors that we take into account when we de-identify, or when we have our healthcare professionals de-identify every image. And Figure 1 was made with this idea of privacy and security in mind, such that every tool that we've built for the image upload process helps to de-identify the patient. And then we have a moderation team that looks at every image before it goes up onto the app, so that no healthcare identifying information, no patient health information is seen on the app.
So I think for us, we have somehow a different point of view. Because so I've been in the business for a couple of years. Before I did this, I was working for the industry, so pharmaceutical healthcare industries. And I think what I find disturbing is that the conversation and dialogue on privacy and security has been very much focused on the process and the security itself, instead of like, how do we reuse the data? So I think we're somehow, at some point, we're missing the point, because instead of talking about the regulation and who has ownership of the data, I think the point that we need to address first is that, how do we make use of the data? How can this data actually be used to better the care of patients? And so whether it's here or in the US, the regulation of data and security has been very much focused on, is it right to use the data? How are we going to prevent it? When in fact, with the 20,000 patients who are already using our platform Health Storylines, it just means that there are at least 20,000 patients who have said, I'm okay to share my data. So I think it's definitely all right to talk about, how do we secure patient privacy? How do we secure the data security? But more than that is, let's have a conversation on how do we benefit? How will patients benefit from health data? So I think that's our point of view on that.
So that actually fits perfectly into our next question, which is around the sale of health data, and how do you explicitly tell this to patients so that you have their consent and they're not just checking a box off without knowing it, and also to the rest of the panel and to the audience, is it right to sell health data?
So it's interesting because I remember sometime in 2009, I was listening to a TED Talk of Sheryl Sandberg, and she said that data is the next goal, and it's actually true. Like, how many companies now are literally gathering data, hoping that one day you can commercialize data. So our view on that is, for a company, we are a health behavior analytics, information, and solutions company. So we generate our revenue, we commercialize the data, we de-identify, we aggregate it. But we have a manifesto, we tell the patients how the data can actually be used. And surprisingly, when you actually tell patients that their data will be used for development of better solutions. Because if you really look at it, like when it comes to healthcare innovation, a lot of the healthcare innovation is driven by either technologists, physicians, or even healthcare administration, right? Like the innovation around EHR was not driven from the point of view of patients, but it's driven from the point of view of administration. We want to improve the process. So the thing is that if you ask patients and tell them how exactly you want to use the data, it's going to be used for research, it's going to be used to improve the care, they're absolutely, surprisingly, they're all right to share the data. For as long as for as long as you determine and explain the different dimensions in which you're going to use the data, for as long as you tell them that, it's not going to affect their employment, it's not going to affect their future relationships, for example, it's not going to affect their future lives, I think, for patients, at least from what we've heard, it's all right for them to commercialize the data. And for our company, our vision is that, and we're starting to get there, is that our vision is that health data will become a health currency. And so since I own the data, I have the right to actually earn money from my data. And so that's our vision for our company.
I think it all comes back to informed consent. Everything in healthcare comes back to informed consent. If we're going to do surgery on a patient, informed consent. And here, when you're going to use patient health records, patient information, ask them for their consent before you aggregate it, before you anonymize it. And I think, just like Grace said, they will be more receptive to having their data used because they know what it's being used for.
It's kind of an interesting line when you look at being a care provider yourself, because any care organization uses patient information to improve the quality of the care that they give to you, right? So if your doctor is actually surveying information about the patients that they see day in and day out, they can use that data to improve the quality of their care. And that's really how we see the usage of data on our platform. It's to improve the quality of the care that we're able to deliver to the end user, the end patient. My philosophy is always, if you're not paying money for a service, or if there's not a clear revenue source other than selling the data, then you're the business model, right? So my philosophy of this is we don't want to sell patient data. We want to use it to improve the quality of care. We want to use it in terms of machine learning to predict disease states. We don't want to sell it.
So I guess just drawing from my experience as it is, which is fundamentally I do believe that privacy is like a tradable commodity, and you should be able to, as an independent human being, trade your health information. But there's some sort of things you have to consider. One is whether you can control, you can actually enforce who gets or who doesn't get your information. And two, in terms of actually improving patient care, there's quite a bit of risk in sort of giving out your information without understanding who actually has access to it. And I think that's where the security issue comes in. It isn't so much in the sharing of information, but is it shared to the right person? And someone who's not authorized to see it, perhaps a future employer, won't use certain information to discriminate me, in any future employment. And it gets tricky because I find it's very difficult to actually anticipate how a certain information could be used in the future because everything is so uncertain. And so this current model has really evolved around the foreseeable future, which is this person is just about to give me care, so they give the information. But I think in the future it will be really interesting to actually give that power back to the patients, but only if they are actually informed about what are the risks and they accept the risks of sort of that new system.
So the weird thing about healthcare that makes it very different from other industries is that a lot of this information is super duper sensitive, right? So we're talking about maybe you're okay if it's I had a rash and it was just contact dermatitis and it went away when I put a steroid cream on it. But if it's you're married and you're getting STI testing and you don't want your spouse to see it, should they be able to see it? We were actually going through this yesterday. We were designing how family plans are going to work on our platform. And the debate was between of course spouses or partners would want to be able to see each other's data, the records. And I was do they? Do they actually want to see that? Because I don't know if I'd be comfortable with that. That's super private, that's super sensitive data. And we realized that by making a decision on whether they could see it or not, we were sort of we could actually change behavior in a way. Yeah, they both should be able to see the kids' records, they can both manage them. But what happens when they get divorced? Who owns their kids' data? Does that get decided in proceedings post-divorce? We get some really interesting territory that starts to get into social engineering in a way. So I think that's super fascinating and an area that we're trying to tread very carefully around.
Keeps people like me employed.
Exactly.
Just while we're on this topic, does anyone from the audience have a question that they'd like to ask?
Teresa Aliya. Last night I was at Blockchain Canada, and it was a wonderful group, but the workshop where we all, just about 100 people, and we broke into over 10 small groups. And one was healthcare, media, retail, obviously fintech, and the rest. So where could blockchain probably help with this issue?
So blockchain for healthcare is an extreme, we're extremely interested. We're starting to work on that area as well. Why? Because again, just imagine that as we go through life and as we probably acquire certain diseases, we're going to have different touch points, right? So our healthcare is going to be merged with our financial data. It's going to be merged with our retail data. It's going to be merged with, even our educational data. And so just imagine the richness of the data that we're able to collect and then tie it back to the implication for health. So imagine, for example, if we merge all of the data together and be able to predict at what point in my life will I have this type of disease? Or at this point in my life, what kind of disease am I going to get? Or what kind of care can I potentially get? And so I think that's the blockchain application for healthcare. And we are, being a behavior analytics company, that is our extreme interest.
I'm gonna sort of hijack that and talk about it. I think the concept is called differential privacy. Is that the correct term? So Apple's investing really heavily into this notion of differential privacy, which is they want to have the same power of Google's data in aggregate without saying anything about the individual data that's ascribed to one person. And I think actually, if that can be done successfully, I think it will be as important as encryption was to society and to our economy, because then you can actually look at health data. Even if someone's like, I don't want you to know anything about me personally, I do want to be able to help the cause of research, to be able to help predict disease, to do all these things. I think that would be really powerful. Not related to blockchain, but it could be. So,
I guess I just want to comment on more of a, just from working with clinicians, one of the I guess, trends I see is people keep thinking that technology is going to solve all the security issues. And that's simply just, I don't think is the case. You can definitely use technology to make it, to make it more secure, but at some point the marginal return on, every unit of resources you put into security just isn't high enough. And sometimes the biggest risks to an organization are always going to be the people, and it's not, and the risk won't be sort of, someone hacking into your system, or someone, like cutting through your servers and plugging in the USB. Like those are really easily solved, and you can put a ton of barriers very cheaply to achieve a reasonable amount of security. But what's really hard to control is, this nurse gets approached by this person and says, hey, here's the money, can you tell me the information? And this is where it gets really interesting as people sort of transition from paper to electronic, which is now you can start tracking people and their access to information. And so I think in the end it's less about sort of modulating the actual technical barriers, but using technology to change people's behaviors and to ensure that people are more accountable, or at least they get caught if they do something.
It's a great example of that. It was, I think, Rouge Rally, where I think it was a nurse was selling information on expectant parents to somebody who sold RESPs, which is like the ultimate breach of trust in a healthcare provider. But that wasn't because the technology wasn't secure. I'm sure the hospital has people that work in IT security that make sure that everything is immune to hackers. It was because someone was approached by some guy who said, here's some money. And that person said, well, I need money right now, so it's not that bad, is it?
Well, then the question is about training your staff, right? It's all about explaining to your employees how powerful this information is and why they shouldn't sell it, for example, or why they should protect it, why they shouldn't be using it on Wi-Fi. And so I think at the end of the day, if the breaches are happening with your employees, it's because you haven't properly trained your employees and educated them on how powerful this data actually is.
Is there a question?
Just wondering if we can ask questions. So a lot of patients are increasingly on social media, things in the cloud, et cetera. Are there any training resources currently available for patients to have a better understanding of privacy and confidentiality issues and sort of that power of their own data and the implications of it?
I think just don't share your health stuff on Facebook.
Or do, it's up to you.
I'm not aware of any.
Well, I mean, just my point of view is that we need to follow the changing behavior of people. And so we are all sharing whatever, all types of information about ourselves, about our family through Facebook or other social media channels, right? And so you would imagine that anything that impacts people's emotions, whether it makes them happy or it makes them, feel, victorious, they would like to share something like that. So within the context of health, what we know from our own company is that patients love to share and connect with other patients because they want to know what works for them, right? So that's one aspect. What works for you? What medications work for you? And because let's say I've been taking this medication, it's not working, I would be interested to know what's working from, for other people as well. So it really depends on the type of information, and I think from our experience, patients are most willing to not only share, as they share, they actually educate other patients. So in terms of finding avenues to educate patients on social media, you will be surprised they are so active, and that's the reason why there is a whole growth in online communities for health. Patients like me, smart patients, forums, blogs, and because for patients, what they're actually missing from the healthcare system, imagine they only have less than 5 minutes or 10 minutes with their doctors, they actually get that from other peers. And so that actually activates them into going through social media. So that's our experience from our company.
So just one more, just to add to that, I think it goes back to what Dustin said, which is in the end is your call. But I much prefer that you're informed about the risks. And I had an interesting story over the weekend. I was visiting my sister, and she's in high school right now, so she grew up with Facebook and whatnot. And she took a look at my passport and thought the photo was funny and just took a picture of it. And with a plan to share on social media. And this is it's a perfect example of just, we keep thinking about sort of us now, but what about sort of kids who are, growing up with, surrounded by Facebook? They don't really understand, what is that risk component. And so to your point, I mean, there's definitely need to have some sort of education process so that they understand, this is okay to share on Facebook. You probably don't want to share that on Facebook.
And just that on that, I think it's a huge barrier to entry for the baby boomers and the older generation as well. So it's a lot of consumers.
There's a question right now. Sure, go ahead.
I have some statements, perhaps I can use the mic to talk about the whole privacy concept.
My name is Akira. I'm a CEO of a company called Privacy Horizons. Our focus is to help startup companies to make sure they're in compliance with privacy regulations so that they can go to an investor for the due diligence process to make sure that all the compliance is in place. So I want to comment that all of the panelists here, I'm very encouraged to hear that you have been thinking about privacy. And all I have to say is, don't make privacy too complicated. There are a lot of people talk about privacy, require a lot of money, cost, and very complicated. In fact, it is not. And also from a product perspective, each one of you have different products out there. Some of them just strictly developed to process information, but some of the product will be just a conduit to pass information. So your privacy requirements will be different. Don't think that you have a common privacy requirement for everything you have to comply with. Think about what you need to do and how you process information, how you handle information. And also focus on patient, right? You talk about patient and information. Be transparent in terms of what you need to do. So it has been, I've been in this business for 20 more years, some years, I'm old here in audience, right? I've been hearing people talk about this all the time, that you have to put all the footnotes, the process in place. Security is the same as privacy, they are not, right? They complement each other, they are not. So there are a lot of education, you need to talk to each other, and again, there are a lot of information available out there. So all I'm asking you, don't think that privacy is so difficult. It can be practical, have to be practical to put it in place. And in terms of training for individuals, there are a lot of information on the Privacy Commissioner website to give you guidance on how to do privacy, how to put best practices in place, how to not to do certain things in social media. There are actually a lot of information out there. The problem is how do you go and look for information? Okay, that's a trick that's from a privacy perspective. And in terms of new technology, blockchain, one of the things that you can use blockchain is about consent. You use the concept of the contract services in blockchain, you can figure out what information I can allow people to use. I can put some directive into those blockchain, right? So there are a lot of things that in the infancy right now is very powerful. It's coming along in the near future. And I think my point is, take a deep breath of privacy and security. Start thinking about what kind of products you're producing. Are you producing something that enable your customer to comply with privacy? Are you developing products that help customer process information? Are you hosting information to manage information, right? All those different products require different privacy requirements. And also for cloud space, right? Use technology to make it easier for your products, right? The problem is a lot of privacy people will tell you that, oh my God, you have to put data in Ontario or in Canada, right? It is not. There's the things that we can think about it. Anyway, thanks for the time. I just want to tell you that be sensitive.
Thank you.
I will take your advice and won't get sued for a privacy breach. I'll send you the legal bill.
So actually, we were going to ask a question along these lines.
So actually, we want to know if the panel, do you think it's really necessary to have really concrete privacy and security measures in place? And if we have these in place, do they enhance or detract from sort of our collective ability to improve the healthcare landscape?
I think you do have to have some degree of control and privacy and security in place. I'm a lawyer, so I'm always going to advocate for that part of it. And I'm employed because this is what I do. I think what you have to do is find a principled approach. The privacy legislation in Canada and in the US was written way back when there were only paper files. And we're trying to adapt this legislation to the economy that we're living in today, to the digital space, and it's not easy. And so what you have to do is find the principles of consent, the principles of security, the principles of being able to disclose when and where you need to, and then apply those to the digital space. So we're filling voids right now because there aren't any concrete laws around digital media and privacy. So we're taking laws from the 20th century and applying it to today's technology, which is difficult. And I do think you do have to have certain processes in place, but always a principled approach.
So I think it's really critical to have policy or at least guidelines on patient information. But I think what we need to do is to put it in context, because oftentimes we talk about privacy and security only because we have to follow the regulations. It's very regulatory driven. And if we continue the path of just thinking about privacy and security within the context of regulatory or regulation, then we are missing the point. We may not be able to collect the data, or even, because ultimately that data is the patient data. Nobody should own health information but the patients. So ultimately the patient should have the power to give consent and decide on what they want to do with their data. However, because we, all of us collectively here, we're companies that actually act as the conduit to collect the data, I think it's critical for us to, still have the boundaries in being able to use, health information.
Maybe. I was thinking about regulations as, so we have lawyers, and we pay them a lot of money to tell us what we should and shouldn't do. And I listen to them maybe half the time. And the thing about something like privacy, which is so critical, is that it's sort of like it is an existential thing for us. We have to be obsessed with it, otherwise we will cease to exist, because if we have a significant breach, then it's over for us. And that's not just because we'll get fined, I don't know, I think the limit went up to $500,000 per organization per breach. Per breach, yeah. So significant, basically we'd be under instantly if something serious happened. But also because that kind of trust, just like you trust your bank with certain financial information about you, just like you trust your doctor today to store information about you, and probably don't realize that it's on a server in their office and it's not very well secured. And the only reason it's secure is because they only have like 1,500 records, and it's not seen as something that's worth going after. To me, it's all about trust. If people don't trust us, we're fucked. If we lose records, we're also fucked. None of that is for regulatory reasons. I mean, some of it is, but if we're worried about regulations being the thing that's going to fuck us, then we're already fucked. There. 5 fucks in one sentence.
So to comment, what Dustin has so eloquently, it is something that's sort of life or death from a regulatory perspective, but from a business perspective, I definitely agree with with almost all the panelists here, which is it's about your use case first. So put the legalese away. This is why we're using this information. This is how we're going to use it. Communicate that to end users, and then explain to them, not also to your users, but to your staff, like this is a thing we're going to do to implement. This is our policy. This is our philosophy. And then you approach the lawyers and you say, can you make this legit? And so we don't get sued.
Can I just sort of follow on to that comment? Because I'm another guy who's been around here for a while, and lawyers are awesome people. But the question for your lawyer is not can we. The question for your lawyer is how might we. Just make sure that that's the way you phrase. How might we? Don't shut me down.
So I have a question.
Yeah. Do you want the mic? Okay.
So I do IoT consulting, I do security, and I do DR services for organizations. And one of the questions that always comes up is around disaster recovery. Is what happens if the pipe bursts? Who knows how to turn off the water, or how do you turn off the main electricity? Where I'm going with this is educating. Everyone's talking about the legalities of not being compliant and having to go to your lawyer and ask them, are we doing this right? But are you kind of educating your employees internally on the safety and the proper way of storing data?
That's consistently, honestly, if I look at the different threat models, and it's kind of something that he said earlier, which was, it's not the technology usually that fails if you have good technology people. Sometimes it happens and it makes headlines, but typically if you have good technologies, it's not the technology. The people are the weak point. And Kevin made a classic example, the social engineer, social hacker. He was able to get information by calling into banks, calling into financial institutions, the DMV, and pretending to be someone who wasn't. And using 2 different people to piece together a complete story that he was able to then take to a third person. So when we coach our developers and our doctors and our nurse practitioners on the threat model, it's usually around really simple stuff like, don't write your password on a sticky note. Don't do it, it's really stupid. And if ever we send you an email asking for your password, don't respond with your password. Call us, right? So that's really what we're paranoid about, especially when you think about having like a distributed workforce. So we have nurses and doctors all across Ontario, and we don't see them physically every day. We have some in our office, and it's easier to coach them. We have to think about how do we educate these people who are far-flung across the province and eventually further than that into the basics of security. And then also how do we design our systems to make sure that even if they do mess up, we sort of catch it and so basically, an example of this is if someone logs in from a different IP address than we've seen before, we ask them to verify through email. Simple things like that.
I think there are about 6 Figure One employees around the room, and I think they'll all tell you that the first thing they do when they walk into Figure One is they have 1-hour training on what the company is and privacy and security and how to take care of the data that we have. They also, at at our all-hands meeting every few Mondays, I get up and say, there's simple things like don't share your password, make sure the building is locked when you leave. Little things that you can tell your employees every week or every month that remind them why they're doing what they're doing and how they should be working.
So in our company, the first thing that we really protect patient information is that breach of patient of privacy and security is actually grounds for termination, just even once. Apart from the onboarding and training where there's a significant discussion on privacy and security protecting patient data, we have a very strict SOP. And one reason is because we actually work with big companies who really, as part of their due diligence so that we can become suppliers to their company, is that we have to follow those specific rules. And so, apart from our own internal rules on privacy and security, we actually have to abide by the rules of our customers. So that's second. And then third is that we have town hall meetings every 2 weeks, and we talk about, we have a chief privacy and security officer who always, not just a reminder, but there's a section on privacy and security. And I know that also sometime a couple of months ago, we launched a sort of like a buddy system where one person is in charge of looking after 3 other colleagues and making sure that those people are actually, following the SOP. So those are some of the things that we employ in the company.
So I think there's like a variety of different sort of safety nets that you can create. Training from that's a great way to just prevent any sort of breaches from happening in the first place, which is great. And I think part of what sort of keeps me up at night are usually we prepare only for the breaches that we know of and that we can anticipate. It's the ones that are like quirky, that we could never have anticipated. Like those are the ones that, it's sort of, you really have to push your imagination to think of it. It could be like, your CTO could be compromised and, he actually has something in his life and he really needs cash. And like these things, you're like, it can never happen, but if it does, like, oh my God, that's a huge, liability on our part. And that's what keeps me up.
Anything else from the audience?
Well, I'm Megan Wilson from Panelist. I'm just curious about, we keep talking about the digital space. People are worrying about the digital privacy, but in your conversations you've had with physicians, patients, and the other people whose privacy you're thinking about, how often have they had a flood in the office, a fire, somebody accidentally threw something into the recycle bin, just regular dumbass luck that makes stuff happen that probably is just as frequent as when they've had a digital breach, but we're not thinking about it. So I'm curious.
So that's a really good point, and I think this is the big thing with transitioning from paper to digital, is in the digital world we can now extract very precisely who had access to what, who opened up, viewed what files when, and that was simply didn't exist with the paper system. And that adds a different level of, I wouldn't say security, but it's more of a behavior modification. You use that as a deterrent tool to say that you probably shouldn't do any shenanigans because we'll know. And like to your point, things like these are things that people don't think about often. Like people keep thinking they're like so unlikely until it actually happens and it's devastating. Things like fires that could destroy tons of records, floods, all these stuff. And particularly in fires, I mean it's okay because the thing's burning and you can sort of keep track of it. With floods, if it just floats like to a bunch of places. Then the information can be intact. I mean, there's all sorts of issues you have to think about in those cases, which is why cloud is the way to go.
I think we're forgetting that there are problems with paper files and with electronic files, but what we should be looking at is the benefits of having electronic health data. The fact that the third leading cause of death by the CDC is doctor error. When you can have patient health data and have the medical background at your fingertips, why wouldn't we? So it's a question of looking at what the advantages are, not just always looking at what the difficulties are with the system.
here's a great example. And I think this is changing now, but up until recently, e-prescribing was kind of a gray area, not necessarily even illegal. Whereas in some jurisdictions in the US, for example, it's mandatory. Because the number of prescribing errors that you can cut down by using e-prescribing is astronomical. When doctors like scribble out a medication, scribble out a dosage, and fax it, and we still have to fax shit. It's ridiculous. Like, and the worst part about it is we fax things electronically. They arrive in an electronic fax inbox, and they had to go over a fax line, and then they print it. But adopting these kinds of technologies is going to have a huge impact on patients' lives. And if you look at, there's a Commonwealth study, a Commonwealth Fund study that looks at, I think, 11 health systems in the OECD. So Canada, the UK, America, Germany, and they sort of looked at a couple of different factors, but one of them was your technology adoption. And the question that they looked at was, are you able to go in to your patient history and sort it by what conditions they have? So if you wanted to find all of your type 1 diabetics between 25 and 35 who had a skin lesion at some point in the last 6 months, can you do that? And if you looked at countries like the UK that had adopted electronic health records in a serious way, it was like 90%. And if you looked at Canada, it was like 20%. And that's a fucking scary thought, because your doctor needs information that they can act on. If they don't have the information, they can't act on it.
So I think we've talked a lot about this from the patient side, and also how patients feel about having their data shared. But I've had conversations with healthcare practitioners who are also very wary about putting their information in, and they're going to get tracked, and potentially their data is going to be sold. Although I'm not sure how many actually think about it that way, but they're concerned that they're going to get tracked by their employer or their boss or somebody above them, or maybe an insurance company. Do you have any thoughts around that?
So you're speaking about the physicians themselves. Yeah, I guess in the end, they're quite similar to the patients, and it's the same problem, just from a different perspective. For us, like we don't deal with that many from a healthcare perspective, but for some of the research data that people collect, there is a possible scenario where it's very sensitive and other people will want access to it, and that's when we start to really coach them on, okay, so you're in for this unique case, these are the types of things we're going to put in place to actually protect your data, not just your personal data, but also data that's very much important to your daily lives, which is our research data as well.
Our platform is for healthcare professionals, and they have the option of whether to come onto the platform as an anonymous person or reveal their identity. And that way they can protect themselves if that's what they're worried about. We have doctors in 100, or healthcare professionals in 190 countries in the world, and every jurisdiction has different legal requirements. And so we give them this option so that they can meet the requirements that they have in their particular jurisdiction.
So I just want to switch gears a little bit and talk more about sort of the idea of patient-centered care. I know that my organization in particular is very interested in this, especially as we move forward and we have an aging population and people are starting to take more and more ownership of their healthcare. So what are some ways that you think that technology can actually influence patient-centered care?
I guess one way, this whole concept like personalized care, it's an interesting one, and I think part of it comes from the frustration of dealing with sort of one-size-fits-all policy in some of these healthcare centers. But I would just like to add on the other side, which is sometimes the patient-centered care, in the end, is most patients don't actually have the medical knowledge to make those decisions. And so in the end, they still rely upon a team of trusted, physicians and team to make that decision for them. And I think it goes back to what Dustin was saying, which is like the trust component. It isn't so much like, the patient takes hold of which treatment they're going to get, but it's more of providing that trust between the patient and the care team to say, I trust you to provide a unique care for me. And I think it's sort of slowly evolving, but making it work actually in a clinic is very difficult given how diverse patient populations can be.
And to build on what Frank is saying, we're looking at it from the healthcare perspective and the healthcare provider perspective and breaking down silos between the doctors, the nurses, the occupational therapists, because it's not the doctor at the top of the pyramid anymore giving the care. It's everyone that's touching the patient is providing healthcare to them. And so breaking down the silos, because yes, your patient is going to use Dr. Google or something like that to find out what's wrong with them, but they don't have the knowledge base to diagnose themselves, and making sure that the silos are broken down between the people who do have the knowledge base to help them.
So this is something that's very personally interesting to me, because the reason why I started Akira was because I'd gone through some thyroid issues. I had a partial thyroidectomy on suspicion of thyroid cancer. And that was like when I was 21 or something like that. So I was interacting with the healthcare system more than people my age typically were. And as someone with like a fairly technical background, I was totally comfortable diving into medical literature, diving into meta studies, and looking at exactly what I was going through and really understanding and internalizing it. And I got to the point where I found out that I really knew more about it. And this is true of anyone who has a chronic condition, by the way, but you've learned that you know more about it than your family doctor, especially, right? Because you live with it. Sometimes you know more than your specialist if you see a specialist. Endocrinologists are really bored with thyroid shit. Like they're like, yeah, come back when you have something more interesting, when at least 2 hormones are going wrong. This one thing, not that interesting. And so I was so frustrated that I was treated like a kid. Like I couldn't really have a lot of say in my own care. I want to be able to order TSH tests. Like I have to do it every 2 months. Why can't I just order it? I can interpret the results. They post the reference range on the labs. I think this is crazy. And I have to call the lab, call the clinic every time I wanted to go and do those tests to get it to the right requisition. It took 3-4 tries to get the secretary. I had to go in, see the doctor for 2 minutes, he wrote the rec, go to the lab, do the blood work. The results, here, this is my favorite thing. No news is good news. Who's comforted by that? Who's ever said, that's great? I don't want to hear the results. I think nobody ever, so. I was like, just tell me what the numbers are. They're not going to freak me out. Like, I understand. And so the principle behind Akira is radical transparency, except in very, very limited cases, typically to do with mental health and like suicidal thought and that kind of stuff. So in very limited cases, you get full access to your record. And so if you have a consult with one of our doctors, you get the clinical note. And at first, our doctors were like, that's crazy, it's your great anxiety, patients can't read this stuff, they won't understand it. And then we said, yeah, maybe, but like, let's just try it out for like a couple months and see how it goes. And I think over a couple thousand consultations we've done this far, we've had one person who was upset that the doctor wrote in his particular chart that he wouldn't give him opioids. Like, by the way, we don't prescribe opioids, and he got upset. And that was it, that's it. It's the only issue anyone's ever had with having access to their own records. And more so, like people have told us, I love being able to see what the doctor was thinking. I understand their viewpoint now, and I can sort of empathize with what they were thinking. And I can use that in my own treatment decisions, and I can use that if I go and I speak to another practitioner, I can show them the clinical notes. So I think that, especially millennials, don't view doctors as like saints. If you talk to your parents, or if you talk to somebody who's like got a really great relationship with a family doctor, they're in their 50s, they're like, yeah, my doctor tells me what to do. Doc, I know I gotta lose weight, but I'm on it, I'm gonna get my cholesterol down. Whereas millennials are really, they look at doctors as a trusted advisor. They're by nature skeptical. They often like to do their research. Not always good research, right? Like there's a lot of crap you can find on the internet. You have to know what to look for. But patients are different, and they want to be involved in their own care. They want to be involved in the decision-making process, and they want to be given options, right? Do I really need these antibiotics? Because I know it's going to mess with my stomach. Are there alternatives? Okay, yeah, let's look at alternatives. Cool. I think I'll start off here soon. Sorry, I ran a little too long.
So I think the convergence of technology and healthcare, where it impacts patient care or delivery of better patient care, is pretty exciting. So there are many dimensions in patient care where technology actually is going to make or is already making a difference on the patient's lives. So number one is transparency. So now with technology, I can actually monitor and collect my information on how I'm taking my medication, how my symptoms are progressing, how I even feel throughout the day, and build that and share that with my doctor. Because imagine, like, we don't go to see our doctors like every month. It's probably once a year, or at best maybe twice a year. And in your next doctor visit, usually there is an expectation from you and the doctor that, if I'm feeling something, I want to get better. But the thing is that from the last time you've seen your doctor, you really don't have any, your doctor doesn't really know much about what happened to you. So just imagine the possibility of the patient being able to build their behavior story and then sharing that with your doctor, which means that the doctor can be better informed in terms of like, okay, maybe you can be given this medication, or maybe you can go through this intervention. Another aspect is we use this principles in our company is the do, learn, and share. What we learn from patients is that technology actually enables me to do something. So when a patient is discharged, I always say this, patients or people have never been trained to be patients, right? When you get to a new job, there's onboarding, there's training. But during that moment when the doctor tells you or discloses to you that, hey, you have cancer, who trains you to follow that, the orders of your patient? So that's also where technology actually will impact, like enable me to do something once I leave the doctor's office. And then the second is learn. How do I learn about my condition? How do I learn about the treatment or interventions that's available? And again, that's where technology will make a difference. Like I can, the physicians can send videos. You can push video, you can push, surveys to your patients. So that's the second part. And then the third part is to share. The sharing of information, which is what I mentioned earlier, to my peers. Sharing of information to my caregivers. How many times have we heard that, probably my mom who's suffering from heart failure, but probably she's 100 miles away, but I want to monitor that. And that's where technology actually will impact. Like I can actually monitor my family members, even if I am not there physically. So these are the three, aspects of healthcare or disease management where technology can actually impact. And the reason why it's important is because ultimately everyone has to make a decision. The patient has to make a decision. The physician will make a decision. And it's technology that will bind all the information together so that we all can make informed decisions.
So just to add a comment, I think there's actually an argument against patient-centered care, which in the sense that sometimes what's really good for the individual is not good for the population. And this is, in a Western sort of, Canadian, US culture is very individualistic. So, the care is very focused on the individual, but we actually don't live, in an isolated bubble. We interact with other people. Population health is a very, very important part of like what makes us society as a whole healthy. And sometimes, to give you an example, like the rise of antibiotic resistance is a very good example when it was good for the individual, which is load up on whatever antibiotics you can find, is not good for the population and on the long term, in the sense that now, because we've been so heavily using antibiotics, whatever all the diseases and the bacteria are evolving so that now none of our drugs actually work. So that's actually very bad for the population. And so, and from here you can actually see where some of the technology can help to actually monitor, and this is actually like actual big data at play, which is to be able to make those population level policies. And maybe sometimes say, there should be a limit to how far an individual can go to pursue their own health without risking, the health of all those around them.
I think that inherent in the definition of patient-centered care, this is actually something that I spent 3 days at the Cleveland Clinic in Cleveland a couple weeks back for their executive visitors program. Got to hear from, the Cleveland Clinic is probably the top 2 hospital systems in the world. It's phenomenal what they do. And they said, we put the patients at the center of everything, patients first. But that actually means patient safety first. It doesn't mean patient satisfaction first. And so you really have to look at the distinguishing between those two things. And I'll give you an example. So on Akira, when you talk to a doctor, you're given the opportunity to rate your experience, right? And if you rate the experience a 1, which thankfully does not happen, 1 out of 5, which thankfully doesn't happen very often, usually what will happen is our chief medical officer will go and he'll examine what went on in that interaction. And sometimes we find that the patient wanted something that was clinically inappropriate. And said, I want antibiotics. And the doctor said, well, I understand that you want that, but really that's not indicated. Here's why it's not the best thing for you. And it's no, I really want them. It's a story, you can't do it. Patient rated them a 1 out of 5. And that wasn't because we didn't provide a great experience, it's because the patient had expectations that were, based on the medical knowledge that we have, not correct. And so it's really important to distinguish between those two things.
Are there any last questions from the audience? Perfect. Are there any last thoughts from the panel? Great. So thank you all so much for coming out. There's food and there's drinks and left at the back, and we hope that you'll stay around, talk to the exhibitors. Our next event is going to be on Wednesday, September 28th, and the topic is going to be transforming the surgical room. So again, we hope that you stick around, chat some more and network, and thank you so much for coming, and thank you to everybody on our panel for joining us. And